This country needs to continue to train and fund scholars addressing one of the most critical issues. And this is an incredible opportunity, in fact, to change the direction of these training of young investigators to be even more engaged with these issues of how do you efficiently provide value while dealing with these huge health disparities we have in receipt of care and delivering the care to people that need it most.
As an alumna of the RWJ program myself, I very keenly see the impact it's had on the U.S. healthcare system. And I think it's so important now more than ever to continue that work and to be able to do so in a meaningful way. And I actually think the idea of making it a program for both physicians and nurses is an amazing first step and will make it an even more relevant program to improving healthcare and health for the entire U.S. population.
The program provided me with an absolutely critical foundational understanding of the health services research methods. And I think this is an unbelievable place for folks who are early in their careers to learn about health services research. And that investment will have incredible returns. Rather than having things happen to us, we will be sitting at the table and directing what's happening.
I study disasters and emergency preparedness in the context of health disparities.
My research interests are around variation in emergency department treatment patterns.
What I'm looking to study is going to be the prevention of HIV and STIs in the underserved and minority communities.
My interest is how we're going to continue to deliver high quality care in an efficient setting and can afford to do it for these patients in a surgical forum.
One of the topics that I'm hoping to work on here is related to glaucoma and the way we deliver glaucoma care.
What brought me to the IHPI, National Clinician Scholars Program, was the diversity of the faculty as well as the ability to work with several different people from different backgrounds.
Everyone talks about the cohort effect, and so you join in with other newly graduated residents, or some of them are surgeons in the middle of their residency.
There are 5 physicians, 1 pharmacist, 1 nurse, and we're working together as a team, and we're learning together as a team. And I think that that is probably one of the real benefits that I can see so far.
When I found about this program and came and interviewed here, I was blown away with the resources and the mentorship.
It's an incredibly collaborative environment. Basically anything you want to do, you can do, and you can find the mentor who's interested in it or can direct you to the right person who's interested in it.
I'm an ophthalmologist, and there aren't very many ophthalmologists in the country who do health services research. But here at Michigan, there's a pretty large group of those. And then outside of ophthalmology, there are so many people to be mentors who are willing to help, who are really experts in their fields.
The other thing I'm really excited about is the access to resources here. In the first 2 weeks, the leadership has talked to us a little bit about some of the research resources that are available to us, and they're really extensive. And so I'm excited for the funding.
Classes, seminars, learning experiences.
Different databases to work with.
Each of the instructors we have really are an expert in what they're teaching us. So when we learn about research methods, we're learning from someone who understands those methods really well and has applied them in studies that have really impacted the way care is delivered in the country.
I've been so impressed with the University of Michigan and their health services research.
This is a really unique opportunity to develop your skills as a leader, develop your skills as a researcher, and while taking the time to really think about what you're interested in, what you're passionate about.
It'll allow me to get the stepping grounds to have better training in policy, research, to be able to take those skills someplace that doesn't exactly have those types of people in place to be able to help out the community.